Okay, so good morning everyone. So hopefully to see you all again. So quite long, I think this time is 3 weeks plus ready. Suppose 2 weeks, because last week we cancel off, is it? So the MHHO also have to postpone ready. So this is the way what to do. So we have to follow the instruction. But essential services can open like our clinic, alternate medicine all can open, no problem. The essential service all they open as usual.
So, do you need to go to Jinjiang Hospital, Doc, or no need?
On a whole again. Yeah, totally they hold it all this kind of thing because a lot of patients will come in, so the hospital also too crowded, so they don't want everybody stuck lah. Okay, so today when come to product, I will talk about one product today. Product is actually pearl powder. Okay, so I think it's very good for Q is there, pearl powder. Okay, we have our pearl powder. It's from the real pearl. Actually, DXN provide a pearl powder from the real pearl. They crush it. Actually, pearl powder already used more than 700 years, especially established in China. You can see from the last time the China king mistress all, they are using pearl powder for their makeup and also they're using mix it and drink. And they're also using pearl powder for fever because pearl have the what do you call pearl as the powerful anti what do you call they call it heating system, cooler system. It can cool down the body. Okay, it can cool down. When you fever, you can mix with the pearl you drink. It can cool down your body heat. It also have the powerful ability to cool down the heat. Can use as a fever medicine also. Okay, but in DXN, the pearl powder is playing a big role for skin collagen. Pearl powder is very powerful skin collagen and also bone protein. Bone protein, not a muscle protein, difference. Bone protein and skin protein. Pearl powder has the same. You see, when you research on a human protein from the skin and the bone. So human protein, skin protein, and also bone protein is equivalent to the pearl powder protein. That's why pearl powder has been used more than 700 years in China and also surrounding countries like Korea, Taiwan, all these countries. And nowadays it's very popular in using as a cosmetic. Okay, lot of facial cosmetic they add in the pearl powder because pearl powder, the goodness of the pearl powder, when you absorb it to the skin, it will absorb to your face skin. So it make you more shiny and more brighter. Okay, so you can adapt together. And you don't need to remove it back. Until certain time, you can adapt together to your skin face. So in long term, your face look very nice lah, like a pearl lah, pearl face. Okay, so that's why pearl powder is very powerful collagen for the skin and the bone. Okay, people who have accident, bone injury, bone density low, osteoporosis. Okay, I recommend them to take pearl powder every day. The quantity you can take 1/4 towards 1 scoop per day. 1/4 towards 1 scoop. You can take 1/4 per day or half scoop per day or 3/4 per day and 1 scoop per day. So don't too much. So the maximum is 1/4 per day is enough for your contents of your calcium and also your collagen to the skin and your bone. Enough ready. So instead of taking like a calcium tablets or calcium supplements, pearl powder playing a big role in this. Okay, so you can recommend pearl powder things, and also it's very easy to absorb to the system, and it won't not storage into your kidney or gallbladder. Okay, gallbladder or bladder or kidney, it won't storage there. Normal calcium tablet, when you're taking the synthetic calcium tablet supplements that you take from outside, sometimes it can storage your kidney, gallbladder, all these things. Okay, so it's not very good in the long run when you take a lot of calcium related, synthetic related tablets, because most of the calcium supplements that in the market, synthetic one, they created from the antacid drug. Actually, it's created from the antacid drug. So sometimes the antacid drug will store inside your body. But when you take pearl powder won't start inside the body. It highly utilized in the utilization of the body system. So it's much better and also giving you a long-term bone density, especially old age after 50 years old. For ladies after 50 years, menopause. I always encourage them to take the pearl powder at least minimum quantity 1/4 scoop per day. Minimum lah, minimum 1/4 scoop lah. If you're not able to put 1 scoop all this thing, at least you minimum take 1/4 scoop per day. You will able to balance the osteoporosis in your body and also balance your skin structure. Okay, because it's a high thin collagen. Okay, for guys, it's also very good if you want to maintain your youngness. Okay, you can use it for your face, and also you can take it. Okay, guys also need a bone density also, because when you're getting older and older, lot of our food has been removed from the dish. Okay, lot of you see, when you're getting older and older, we won't take too much of food. We are getting smaller portion of the food. When we start to reduce our smaller portion to food, we are lack of some proteins for the bone and skin. So you can add in as your supplement for long term. This is no side effect. You can take it for long term, no issue. Okay. So okay, so this is about the pearl powder that DXN has. Okay, nowadays it's actually hot cake in DXN nowadays. I see really a lot of people are buying that, using that as a collagen. You can see a lot of people have a lot of changes and got a lot of good feedback on this pearl powder in DXN. Okay, so any question on the pearl powder? You want to ask anything? You can on the mic and ask before we go to the questions.
Yeah, Doc, how do you, per quarter scoop, do you mix with water?
Okay, you can mix with any juices.
Oh,
sometimes with water, you can mix with water, you can drink. But sometimes, you know, people think the plain water have some taste, so you feel like, hey, something, why like that? So when you add into the morinza, or you can add into the apple juices, or you can use any juices, so you feel much better lah. Easy to drink lah. But you still can use normal water also. Plain water also shouldn't be a problem.
Warm or just normal?
Warm or plain, no issue. No issue. No issue.
All right.
Okay, good. Any other questions before we go to the question and answers Q&A session?
Yes, it's the other day my cousin come and visit me. Then they the powder. Then the powder is shining. Then she kept emphasizing a lot of mercury inside. So I said, no.
Where got mercury inside? You see, you must understand one thing clearly from the DXN product. All the DXN product already has HACCP report. Okay? HACCP report, hazard control analysis report. So this report, any single chemical or any genetically modified things that we use, the product won't get approval from the organic department. Okay, so the shining is not the mercury at all. Okay, if it's mercury, so long we cannot get approval from KKM lah. First thing they will reject it. Okay, it's not easy. So people can see, but it's already tested in the lab, verified in HACCP. It takes 6 months for the trial in a pharmaceutical lab. They test it, then only they give us a certificate that our product is very clear cut, no issue or anything. So that's why if anybody asks, you don't need to worry. You tell them that we got KKM approval, we got organic endorsement approval, we got HACCP report. The HACCP report is a very powerful report given by the pharmaceutical industry. Okay, when they tested the product 6 months in the lab and make sure it don't have any problems and it not contain of any single chemicals, mercury, as methyl salicylate or any sildenafil or any other chemicals that prohibited by the pharmaceutical industry. Okay, mercury is highly prohibited from marketing pharmaceutical industry, so you cannot add in simply. Okay, so you no need to worry at all. Okay. Clear? Tell them. Or you can go to the website, you can print out the HACCP report, give it to them. Let them see. Okay? So you must understand that our product is completely endorsed with all the certifications. So people can say this and that. Even though I tell you one recently in a group come out with what you call in the NPRA, they said our Ganotheraphy can damage the kidney and liver. Okay, that one actually you have to see in the market in Malaysia, they got more than 200 companies distributing Ganotherapy. Okay, distributing Ganotherapy. So all the Ganotherapy that we send is completely clean and follow the procedure of Kementerian Kesihatan Malaysia and also Therapeutic Good Administration of Australia. TGA is a highly endorsed body in the world that when they endorse your product, you can export to 36 developed countries. That's why TGA is the highest certification in the health industry. Okay, and also ISO 1401, Environmental Control Management. Okay, this Environmental Control Management, ISO 1401, I tell you in Malaysia, less than 10 company has. So the one that in the market, there's some chemicals added into the Ganotherapy and sell it. So people who take the Ganotherapy from other company that not endorsed have some problems because they never follow the actual SOP of procedures of farming or anything. They don't have ISO 1400, they don't have HACCP report, they don't have organic endorsement, they don't have KKM endorsement, and they keep on selling. Even though today you go to any what you call Chinese medicine center, you just ask for linseed, they can give you from the bottle, they can book up here. Don't know where is this, they can powder, they just pack and give in a plastic bag or wrap into a normal pepper. And so what is the quality that you see? One time I remember Dr. Lim, we talked about in this matter with Dr. Lim one time. He told that our one, we never use a groundwater. All our Ganotherapy is using higher level, more than 2 feet from the ground, and it has a moisturization effect, and we don't use water at all. Okay, even though water can contain with chlorine, all these things, we don't use it at all. We only have water vapor that's from the grounded water, from the boring water. So you see, there's the things, and all the things already baked in every single formula on the ingredients to grow the Ganotherapy has been tested, and every batch that want to release out, KKM will check, you know. So that's why there's a batch number. You see, all your product got batch number. Remember always, before the batch is out for the consumer, KKM will go to the farm and do a random checking, endorse, then only the batch can go out. It's not simple, huh? Okay, not like acang business, belakang rumah buat packing, can sell, not like that. You see, we have a very strict system to be followed. Okay, so when we check with the NPRA department, they told us they just put it generally. Okay, that product, but our product is completely free from all these things. Otherwise, they can suspend our product. Correct or not? If really our Ganotherapy got problem, you think the government will quiet? True or not? You think they will quiet? They immediately come and block and suspend everything, you know. It's not joke, because it's actually related on the people, human. So in our Ganotherapy really help the kidney problem reversed. I've treated so many kidney reverse problem. And even though Selayang Hospital doctors also, after see our kidney stage 4 patients reduced their CKD, the creatine level, they are shocked in EPO. So a lot of people has been improved. The problem is in the market, there are a lot of products that not have endorsement, don't know where they get the product, never follow the SOP, and same thing lah. Okay. So that's why it's very, very important in the farming procedure. It's very important. That's why the certification control all the procedures. Okay, so you must be very clear on that. If sure there's a lot of questions. I got a lot of questions. Once they come out, they can. So when we check back to the industry, they say it is nothing to do with it. Your product, no problem. So why you worried? Then we don't need to worry, lah. Correct or not? So these are the things that you need to understand now. When you explain to the people, you need to explain clearly. Okay, then in the market, people will know. You know, people when come to the problem, they whole world no. But when you explain that clearly, then it shouldn't be a problem. Okay, and we are 27 years producing the Ganotheraphy in Malaysia. Even TV3, all the pharmaceutical industry people also come down to DXN and visit them personally. Okay, so nothing to be worried. So you can freely can eat Ganotherapy from DXN. I don't say other company I don't know. Okay, because lot of Achong Ali bin company is in the market producing so many products. Okay, without any certification or any problems issues. Okay, clear? So I think you're all clear. So anything you want to know more about, you just update me. Okay, then I can give you a good the examples and ideas what is actually. So we follow exactly all the criteria. That's why you see, if the pearl powder is been let's say mercury, you think TGA will endorse? Cannot. Okay. If our Ganotherapy got problem, now we already have 280 country, okay, 185 country in the world. None of the countries come out with the problem one. Okay, so you must understand all these things. We are very clear on this. Okay, clear. So okay, good. Any other questions before we go to the Q&A?
Doc, one question from Annie. She's asking, can cancer patient take pearl powder?
Okay, depend on the, okay, pearl powder actually not a treatment. Must understand one thing. Some natural supplements we can use as a treatment. Some we can use as a food. So pearl powder comes under food category. Like for example, calcium tablet, doctor can prescribe for anybody. Okay, when you go hospital, they can subscribe to when you have a bone pain, all these things, they will prescribe you calcium because it's not contra with any, complicate with any other products. Okay, so, but our one is more clear. So any patient can take pearl powder or any normal people can take pearl powder, no issue. So it's not comes under the treatment base. It comes under the normal food supply base. It's a food supply base to just top up your system. Like just you eating a mango, you eating, so you eat a pearl powder lah. You are eating so much of seafood, what? Okay, so seafood is seafood, but pearl powder is not a seafood. It's totally out from the okay, clear?
Doc, additional kita boleh juga campur pearl powder dalam kita punya coffee, which doctor always mention all the time.
Can, no problem. That's why I said pearl powder is very safe. You can add in anything. So it can go inside your body is enough. It will do that because it's considered food. You can add in a coffee, you can add in your thing, you can add in your juices, or you want to drink it with a plain water, can, no problem. It also reduce your body heat also. Okay? Okay, Frankie?
In case Matthew want to buy a few coffee cordyceps linesman from DXN tomorrow. I take it twice, morning and before I sleep. 1 scoop of pearl powder in my coffee.
Okay, so good. So we go to the Q&A now. Okay, the first question is, can a person with high insulin more than 20 years take DXN product and stop completely? The answer is yes, but you must do it gradually. You cannot immediately stop. You must go together gradually. With a conditional means that we need to see how your progress is. So let's say you take 4 times insulin. So you give androgy, you also have to change in food. You must understand, diabetes is not a disease. Sugar never kill anyone. Okay? If sugar kill you, when you fainted, you go hospital, they put your sugar inside your mouth. True or not? Huh? True or not? When you fainted, you go inside hospital, they give you the sugar what? What the sugar they give you? They give you a brown sugar. Huh? They give you white sugar also inside your mouth. So sugar reality never kill you. You must understand what is the difference between sugar and glucose. Then you know. So that's why eating style is very important. Eating time frame is so very important. Okay, when you want to take the product, DXN product, you can take together with the modern medicine, no problem. Insulin, metformin, all these things together, and get the advice from the doctors or holistic medicine practitioners. Then balance accordingly. So you can send to me all your detail. I can guide you what to do little bit. So you can reduce like what do you call maybe 10 ml of 10 IU of insulin. Maybe after 2 weeks 9 IU. You reduce little bit. I've reversed so many patients in Semenanjung here this side. So many patients. 4 times insulin, now 0 insulin. Okay, their sugar is balanced already. So it's all depend not only DXN product. It's your habit, it's your food intake, and also your sleeping time. We need to have good sleep around 6 to 8 hours. And your lunch time, your breakfast time 7 to 9, your lunch is 12:30 to 1:30, your tea time is 4 to 5, your dinner is 6:30 to 8:30. After 8:30, no food allowed to the body. Remember always, you can just get a half cup of milk is enough. Okay, so can a person with high insulin? Can. So we have to follow the gradually balance it accordingly. So what are the product can help you? RGGL can help you. Androgy can help you. MycoVG, Morinzy can help you. MycoVG, Morinzyme can help you. So these are the product can help you to balance your metabolism rate. Then slowly we monitor gradually, then we reduce little bit until certain things. And at the same time, you must have a good exercise, good sleep, correct time of food eating, and a clear mindset. Mindset is very important. Okay, you do everything, your mind corrupted, then cannot do anything. Okay, so that is a thing. And in the longer run, almost like 6 months to 1 year time, you can reduce it completely. Like my mother, it took me 1 year to completely stop all the insulin. Because before I study, I came down, she was in insulin, she was in bag by bag of plastic. One day she eating almost 20 type of medicine, drugs, tablets, then insulin. So we slowly reduce. Now she's okay. Almost 16, 17 years, she never touched a single medicine now. Everything is applicable with your correct, somebody balance you correctly, follow accordingly. Because I see in hospital, until now, no one is reversed, because it's not to say they have no time. There are too many patients. They have no time to handle you one by one. So they have no time. So they just prescribe you, just go like a manufacturing factory. You just create you like that. So they just write out to go back. So next time you come out, other doctor will prescribe you. There's no the same doctor. The doctors are changed. So they have to go A to Z. Then they prescribe you something different. Then next time you go, change doctor. So you don't have a proper guidance and proper things to guide you to reverse back your system back to normal. Okay. So number 2, what is product recommended for people with skin allergy, eczema? Skin allergy, eczema is normally we have to clear their stomach area. That's why a lot of allergy will affect them when they eat something. Okay, so the first thing you see, eczema, all these things will occur when you have something wrong food. So when you have wrong food, the same food other people also eat. But why you got all this allergy coming out? Means that there is a problem on a metabolism. That means your digestion issue. So you need to clear your digestion part, exactly like it's your leaky guts. Your leaky guts. That means your guts is no more protecting you to penetrate only nutrition towards your bloodstream. The junk is supposed to be go out. But when the junk start to penetrate to your blood, your body start to react differently. Your liver start to activate it. So the eczema or psoriasis, all these things will flare up. Okay, so you must understand first thing, why the flaring is high when you wrongly eat. What happened? So when your food coming in, something wrong in the pipeline on your digestion system. So when your digestive system is weak, okay, is imbalanced, then you need a proper cleansing of your colon system. That's why you must clean the colon system. At the same time, you must avoid certain food for time being until you completely clear. But you clear here, you put here, you clear here, you put here, then no problem, because the colon start. We want to close the gap, the leaky guts, but you make it open again. Okay, so the best part, you must give micro-AG, morinzyme to cleanse the colon, build the good bacteria in the colon system. Second thing, you can change our soap, all these things. You can use Gano soap, Gano oil for external use. Then you take a lot of vitamin C, Roselle, vitamin C. Because vitamin C playing a big role. And in this case, you also can add in pearl powder. Because pearl powder also will regenerate the skin back to normal skin. Okay, that is a things like, but it take time. Eczema take time. But you must be very control. You must be control your food. Okay, and in a long run it will be key. Because I'm one of the eczema patient. I'm completely reversed back. Okay, I've suffered from almost 12 years, 13 years suffering from the eczema. Then after I study all the holistic medicine, I reversed myself. It's completely reversed. So it's all based on your body system. Okay, eczema, any kind of colon system, allergy, everything is based on your colon issues. You must cleanse your colon. That's why our micro-AG and morinzyme playing a big role to cleanse the colon and balance the back. So you can take long time. When your clean system is clean, like 1 week one also, you can just take the micro-AG morinzyme to just cleanse it out. So you don't storage any chemicals or any imbalance of a wireless system or colon metabolism system. It's much better. You create more good bacteria in the colon system. Okay, number 3. Understand the doctor-treated patient with HIV positive cases. Play about what is the recommended product. Okay, you see, RGGL is very powerful detoxification system in the world. Okay, RG and GL is the highest powerful system detoxification in the world. So what RG do? Remove the toxin out from the body. GL will balance the body. So when you do this, actually you must understand one thing. Ganotherapy treatment never treat any diseases. It immunizes your system. It removes the toxin out from the body. So in the HIV patient cases, virus is stuck into the system. Okay, when the virus stuck into the system, it start to penetrate the system. It start to make the system worse. So what does the system it attack? It attack the immunity system. HIV also attack the immunity system. Cancer also attack the immunity system. So when you can reverse back, strengthen back the immunity system, then you can reverse back your any type of viruses in your body. Same thing come back to the dengue. With Roselle and GL, within 24 hours to 48 hours, you can reverse back the dengue patient. You can see the platelet go back, everything go back to normal. Same thing, unknown viruses. I've treated a lot of unknown viruses become coma. After giving a GL and Richelium, all these things mixed with the milk, give to the nasal treatment, 3 days, 4 days, they can wake up. That means the virus has been removed from the system. Normally, there are a lot of viruses attack the brain. There are a lot of viruses attack the heart. So when you start to put in, the virus will be eliminated from the system. Your immune system able to eliminate the virus from your system. Okay, same thing like vaccine. Why vaccine is given? Vaccine is to boost your immune. But we don't understand how everybody's immune system works. Maybe the vaccine is work with for you, but it won't work for second people because the immune system are different. That's why you can see the vaccine cannot work much equally to everybody because everybody immune system are weakened, difference. Okay, so that's why we have to see. We have treated a lot of HIV patients. After they're taking, the viral load is reduced. the what do you call it, CD count, CD4, CD8 become improved. So CD4, CD8, CD4, CD8 and the virus load, all these things is under the immunity system. So when you keep on pumping high dosage of mycovita, normally we give mycovita 1 day 1 sachet with Morinzi. So Morinzi mycovita is enough for any kind of virus impact, high level virus. Okay, like HIV is high level virus. So when you give them, you can see in 3 months, 6 months, 1 year time, the viral load become normal. CD count, CD4, CD8 become normal. So when these parameters become normal, you almost no problem. You almost like you almost clear. People with HIV, they have a lot of viral. The viral load show 50,000, 200,000, 300,000. But when you pump in, the viral load become normal already. Then no problem lah. Okay, so it depends on the case basis lah. Okay, but for Ganotherapy treatment, is no need to worry. You just pump in, vacuum with 1 sachet per day, and then you can see the difference. I got a lot of cases, it's reversed back normal. But we can't publish anything lah. That's the thing lah. So whoever got, we just give them, clear it, then they are happy, they don't die enough lah. What else you want? Okay, and they don't damage with it, because you see here, HIV virus attack the immune. When they attack the immune, they are open to the system. When the system is open, they can attack with flu, they can attack with pneumonia, they can attack with any kind of viruses, any kind of bacteria, any kind of diseases. They can have arthritis, they can have anything. Because the immune is open, no protection. Your country is open, no border, no security guard in your border. So everybody without passport can enter. This is the problem of the thing. Okay. So, but in a treatment, we are giving virus. We just suppress the virus, suppress the virus, suppress the virus. You stop the virus suppression, then the virus load back again. But in a Ganotherapy treatment, we don't suppress the virus. We improve the immune system. We strengthen the immune system. Let the immune system take care of the body. Okay. So the next case is number 4. Some people say that after taking DXN product must take break, as our body may getting used to the product and become immune. Is there any truth in this talk? Okay. In this case, you see, Ganotherapy treatment or holistic medication is categorized under food. Every day you're taking rice. Every day you're taking vegetable. Every day you're eating chicken. Okay. It's like that. So you don't need to worry at all. It won't harm you. It won't damage you. Unless you're putting some drugs in your body, then it will damage you. Okay. You see, nowadays people taking lot of medication. All the medication is drugs. It's also poison. You take too much, also is poison. So today the drugs that you taken, it's still stored in your body. You think within the 24 hours it will come out from the body? No. It takes time. Then tomorrow morning you pump in a lot of medicine in your body. The next day, the next day, the next day. So the body is already immunized with a lot of drugs inside the body. That is dangerous. But when it comes to the food, today you eat, lunch you eat, evening you eat, dinner you eat, okay? Then tomorrow morning you eat, it's okay. Unless if it's natural, it don't have any side effect, it's a purely from the organic, you no need to worry. It's all under categorized under food. It's not food supplement, it's a food. That's why holistic medication, I don't call it food supplement. I call it a food that has highest nutraceutical effect. Okay, I don't put under supplement. Supplement is like a calcium tablet, iron tablet that you go and take in the market. Okay, but when you say holistic food, is a food that has highest nutraceutical effect. That means highest nutrition, the organic vegetable or plants that have highest nutrition and also has highest therapeutic effect. Okay, pharmaceutical therapeutic effect. So a food that contains high nutrition with therapeutic effect, we call it a superfood lah. Okay, like spirulina. You see, this any amount that we can take or we cannot take is unlimited. You can see in African country, they supply the spirulina in water base. Okay, the children they go and just take a cup and they just drink like a water, you know. Okay, so no harm. Same thing like Ganodrama. You can eat. You go to makan time, you cook mushroom, sweet sour mushroom, this one cooking mushroom, all these things you are eating. So many thousand years Chinese are eating more. Chinese are more eating mushroom. Indian is second largest. I don't know how's Malay eating the mushrooms. But mostly mushroom, like button mushroom. You see, every koitia you buy also got mushroom. Every rice you buy also got mushroom. So it's like normal food. Okay. So what you're taking in DXN, everything is under considered food. So you don't need to worry at all. Okay. You won't damage your system. Okay. So only the concern about money lah. If you eat too much, then you have to spend more lah. If you have enough money, you can drink lah. It's no problem lah. You can buy every day one sachet. Like me, every day I just put one sachet of mycovita mixed with the morinzam, codipine, everything. Make fruit juices. Every day morning we just drink. So it's okay. Okay, it's nothing to worry. So many years I'm taking one sachet of mycovita. Nothing, you know. My one sachet of mycovita is almost like 35 rg, 35 gl, 33 rg. One sachet. You just mix in the drink. You just drink lah. No problem lah. Okay. You make your immune system strong. It's a food. So sometimes morning I drink that. I don't take my breakfast. Straight away I take my lunch. So many years. Okay. So nothing to be worried. Okay. Because you are taking a food, not a medicine. So take it out from your mind. Holistic things is actually food. It's not a medicine. We only treat the system, improve the system, immunize the system, make the system improved, strong to fight any diseases or any bacteria or any viruses that try to attack the body. So you shield the system. Then you don't need to worry. Okay? Okay, next question. Okay, DXN coffee known by have to calming effect, but there are some who couldn't sleep at all. Before drinking coffee can sleep, after DXN coffee can't sleep. Why? Okay, from the first time when you take coffee, you will feel that. Because antioxidant effect and actually the coffee is anti-depression. Real coffee, organic coffee has anti-depression effect. So when you're depressed, when you stress, when you take the coffee, you feel relaxed. Sometimes when you feel relaxed, okay, DXN coffee has a lot of oxygen, GL has been added. So you feel more energetic. After taking coffee, you feel more energetic. So you don't feel to sleep. In reality, every day at night, I'm taking coffee and sleep because I'm already immune. I already balanced it today because I don't have any depression issues, all these things. People who have a depression, stress level high, whoever take the coffee, it will do the anti-depression effect and slowly they can go sleep. But when you continually take, you can have the calming effect very high. Okay, in first time you will have imbalanced, but when you keep on continuing taking, you don't have this problem anymore. Okay, so you don't need to worry on that. You can drink coffee anytime. DXN coffee, no problem. But outside coffee, I don't know. Okay. Right. Next is which question now? For number 5 is it? Number 6 now? Number 6.
7. Number 7, Doc.
Why blood sugar? Number 6.
Oh, number 6. Sorry, Doc.
Why blood sugar not regulated after taking DXN coffee? Okay, DXN coffee activated your see, coffee is a blood circulatory. Okay, coffee is a blood circulatory. So when you take coffee, it enhances the circulation. Okay, when it enhances the circulation, it starts to cleanse up all the piping. So you can see your sugar level sometimes is up and down, sometimes clear. It depends on the situation. How much of sugar you stored inside. Like for example, you have a drainage system, suddenly you put a water, powerful water, all the dirt will come out. Okay. After a while, then they become normal again. So this is how it works. So that's why I always say for the diabetes people, I ask them to take a black coffee. But sometimes after they're taking the black coffee, even though the black coffee don't have sugar, But suddenly you can see a spike of sugar. Actually, that coffee is cleansing the drainage that the sugar has been storage at the layer of your blood vessels. Okay, most of the vessels has been stored with the sugar. But when you give a high impact of a circulatory system, this thing will come out and it's a cleansing process. But when you keep on continue taking a black coffee, you can see your sugar will be better. Your sugar amount, the glucose level will improve a lot actually. That's why the black coffee is very powerful in terms of balancing the sugar level. Okay, the black coffee that we use is actually organic endorsed, so no need to worry. Okay, question number 7. Androgy good for sleep at night, also good for regulating blood sugar, help inflammatory. Yes, some members have taken athletes and they notice that they are less stressed and more calm. Appreciate doctor's explanation effect of the human body. Okay, Androgy actually they call it Hampudu Bhumi, and it's very powerful plant leaf that no side effect. Okay, no side effect, has highest bitter and no side effect. Okay, so this bitterness is actually regulate your blood sugar. Okay, because bitter and sugar when you combine, the bitter will pass first, the sugar will come down. This is the first effect. Second thing, it also natural anticoagulant agent. What you call it, it's actually like a blood thinning lah. It also help to regulate your blood. It's not thin your blood, it's regulate your blood to the normal condition of the blood. So people who have like thick blood a bit, so when this one go in, it can regulate the blood. So when regulation blood is improved, the more oxygen can be brought to your brain area and also all over your body. So it will relax, it will calm down your body and you can sleep well in the night because the blood start to circulate to the brain. It's also a blood thinning agent. Okay. Then the androgy have the impact on the liver. It also very good liver enzymes. It has a very good liver enzyme and protect the liver from damages. Okay, that's why when you see Himalayan product got Leaf 32, Leaf 32, and also got another product called it. This is all actually very good for liver. So when you see the category of Leaf 32, androgy, all this thing, androgy is in the first category, class 1, then Leaf 32, then others. So a lot of people come and ask me, hey, why Leaf 32? Yes, Leaf 32 also very good. I don't say it's not good. But when you see classification of book, alternative medicine classification, you see androgy is the highest ranking than the Leaf 32. So that's why Dr. Lim always go and get the highest category in the thing, only will endorse into the DXN in the product. He won't take the middle one. For example, last time we have Corella and Spirulina. Okay, last time DXN produced Corella, no? Corella and also Spirulina. Okay, Corella and Spirulina, both is same. Okay, both is same function. But when you see categorized level, Corella is lower than the Spirulina. So NASA, UNESCO, WHO endorse Spirulina higher than the Corella. So we Dr. Lim removed the Corella, then they just focus on the highest top. Okay, same thing to others also. So like Lindsay, why he bring the Lindsay in? Because it's a king of herbs. Spirulina is a king of superfood, greens. Enzyme, Morinzi is a king of enzyme. Morinzi is king of enzyme. Because it's been used more than 1,000, 10,000 years ago. Highest used. If you go and dig the research of every product in DXN, it's an ancient food that have been used in the ancient times. That's why you need to go and research on this product. Like black cumin, albatus sauda. So many years has been used from the Arabic, from this one. Lion's mane, so many years has been used. It's not a single product that comes today, no. Whatever we eat now is already been taken by 2,000 years ago by our ancestors. Not new product in DXN. People say, you got new product, it's not new. It's already more than 2,000 years. People already eat and survive so many years. Okay, and it balances your body, it improves your immune system, it strengthens your immune system. Enough. We don't need to treat anything. Our body is very improved, intelligent. It needs some nutrition that highly nutraceutical effect nutrition that affect your body system enough. Then the body will run. You don't need to put things into your body. No need, not necessary at all. Okay, so that's why androgy is playing a big role. Recently Thailand approved the androgy for COVID treatment. Thailand approved, Thailand government approved androgy for COVID treatment. In India, already approved so long. Okay, now people are doing a soup. And they pick the androgy leaf, they put into the thing, they make a soup, boil it, and drink the water. Means that the androgy never give. If you can drink like a water like nobody business, means that it not harm to your organs. It improve your immune system. It can enhance the immunity system to prevent the bacteria to attack you. Okay, so that's why it used as a COVID treatment in India and Thailand and so many other countries we don't see yet. So in Malaysia, I've given to a lot of people. Okay, even though you got running nose, all these things, take androgy, fever, take androgy. It will give you a very good immunity system and balance your blood circulatory and also calm down your situation, cool down your heat. Okay, so that's why androgy playing a big role in the industry. You see, I've come out with the research paper. I already published in the international journal. Before India approved, before Thailand approved, we already come out with the paper to you all know. So we are more advanced than them, you have seen, we are more advanced than them. The government only now approve. We already approved so long. We already published it. So many people use it. Okay, I tell you now, the research paper more than 12,000 views in the OGPM in the thing. You can see more than 12,000 views, and so many people sending me email asking where to get all these things. So I just guide them where to get all these things. Okay, the single paper is getting the highest journal views in the OGPM. You can go and see highest, very highest. That one paper can overtake every journals in that there. Okay, because it's really useful. When you follow that work, a patient in Dubai positive for 30 days. After taking the dosage in Dubai, they go and buy at Dubai and eat. Okay, reversed in 3 days, reversed. And in Malaysia, so many people are taking. Every day I got order from the set. That's why I give you the pamphlets. I see today I share it to you all. If people very hard, they have no cash, at least they take the small dosage, take one per day, also good ready. At least you immunize your system. Give to your children, make sure you immunize, because they're going out, they're going to school, we don't know. Okay, and we don't know how deadly it is. It also depends on immune system. If the immune system is strong, even though virus attack you, within 3 to 5 days you are reversed. If your immune system not strong, then you got a problem. So don't worry about your things. Immune system enough. Okay, make sure you got that. And it's very safe to give to the children also. Below 6 months, we don't give androgy. But after 6 months, it's no problem. Below 6 months, you can give RGGL. You can give glycosamine below 6 months. But androgy after 6 months you give, because baby is too small. Okay, after 6 months, no problem. Okay, now next question. Constipation, migraine, gout, one patient, elaborate prescribed supplement. Okay, constipation, lot of migraine patient. Okay, migraine, headache, gout, acidic, all these things due to your colon problem. Remember that always. Okay, when your colon is not good, high acidic, they got migraine, they got constipation. First thing you ask them, what time they eat. Their time of eating is out. Go back and settle your time for him first. Eat on time. 7 to 9 is your breakfast. 12:30 to 1:30 is your lunch. 4 to 5 tea time. 6:30 to 8:30 dinner. Finish. After 8:30, no food allowed to your stomach. People got migraine, constipation, gout, all these things. You ask them the food, you know already how bad he is food eater. 12 o'clock, 11 o'clock also go to roti canai. Nasi lemak, I am going on. I tell you, you can ask them lah. Okay, now we are very bad in eating. We need to change. Then everything will change. Okay, ask them to change eating style first. Eat, munch properly. After eating half an hour, Don't drink water. Then sip by sip water drinking. Give them a micro-veggie, more enzyme, cleanse their colon system. RGGL, androgen, glycosamine. Then should be enough ready. Or you can give micro-veggie, more enzyme is a must for these cases. But other than that, you want to give codipine, you want to give GL powder, you want to give RGGL is secondary. So you got the dose 1, dose 2. Then slowly you can see that they are out from the total problem. They are completely out from the problem. Okay, I've reversed so much of arthritis patient, gout patient. Gout is the first level of arthritis. They start with gout, muscle cramps, pulling. Okay, then the muscles are tired. After a while, then the muscle and nerve system start to damage. That is arthritis. After a while, muscle, nerve and bone damage. That is rheumatoid arthritis. So you start with gout, arthritis and rheumatoid arthritis. This is the continuous things. So when you have gout, remember your muscle has been rusted. When your arthritis, muscle and nerve system are rusted. When you have rheumatoid arthritis, muscle, nerve system and bone is rusted, so completely jammed because it's already rusted. The things compile together already. You cannot move already. So you taking all these things, mycoG, more enzyme, clear your thing. Lot of arthritis patient have a constipation issue. Lot of migraine patient have a constipation issue. Lot of skin disease patient have a constipation issue. Their toilet is not clear. Okay, either constipated or diarrhea or tools are becomes like you can see the tools are like breaking, okay, and non-timing tools. Sometimes suddenly 12 o'clock, 1 o'clock early morning they go toilet. Non-balanced colon system. Okay, so balance it, then should be okay. Okay, next. What is your opinion on intermittent fasting? Some doctor recommended. Okay, you must understand one thing. From the day one you born, you already have your own intermittent fasting. Your intermittent fasting follow the nature. And nowadays I see a lot of people come out in this, la, that, la, A, la, B, la, yeah, I don't know, I la. Very follow the nature. Daytime we work, nighttime we sleep. Okay, that's why I see food timing is very important. By 8:30, make sure you complete your dinner. Kitchen close. After 8:30 up to next day morning 7. Almost 11 hours, you are already naturally intermittent fasting. The body cleansing, the body processing, the body regenerating, rejuvenating, balance back, repair back, and wake you up. Okay, so what you can bring 8:30 after night, after your dinner, last dinner, 8:30 before, 6:30, 8:30 complete. Okay, after 8:30, you can just drink juices, mild juices, or you don't like juices, you can go for small hot drinks like a milk, half cup of milk, not 1 glass, 2 glass, half cup of milk or half cup of cocoa without sugar, without any contents of things. Plain cocoa, plain milk, or a coffee or cocoa tea, something like that, simple, but very small amount. Why to take this before you sleep? To make sure early morning your acid in the stomach is being digested with this food. So you won't wake up 3 o'clock in the morning and go for eating. Okay, if you don't take anything in the supper, 3 or 4 o'clock, then you can see your stomach start to sound ready, hunger ready. Okay, start to hungry. So make sure you take something, but your dinner cannot be more than 8:30. This has been practiced so many thousand years in India. In India now you go so many small restaurants. 9 o'clock they shop. They will ask you, 8:30 all they come and ask you, kitchen going to close? Please make your last order. They close. They don't cook anymore already. It's been expert practice. So your body will go intermittent fasting ready. When you eat 10 o'clock, remember 11 o'clock you have to go to bed. You think your food is completely digested? No. Half digested, half inside your stomach. Now you sleep. Your food is still there. Early morning you wake up, 7 o'clock, 6:30 you wake up, 7 o'clock. The food start to digest now. The long hours food that you eat yesterday night, digesting today morning, what is happening? Did you get a good glucose, good vitamin, good minerals? All these things are bad. This can damage your organs. Your glucose is being, bad glucose is produced because from the bad food. It's more than 6 hours, say 8 hours, it's stored inside your stomach, not digested. You sleep. When you sleep, there's no movement. There's no peristaltic movement to digest your colon. Acid is increased, accumulated. Then you damage your colon. That's why eating time is very, very important. The first thing, why diabetes now very high? Because the first thing, they don't follow the right food time. When they don't follow right food time, do you expect the food digestion completed? No. That's why in a medical book also they said it's a metabolism weakness. Diabetes is a metabolism weakness. Never digest. The food is not digest. If food is not digest, you expect the glucose, good glucose will produce? No. So you must make sure your food is digested and the contents of the food should be digested and release what to be released? Good vitamins, good mineral, good amino acid, good glucose. Okay, all these things we need to release to your bloodstream. Then your 60 trillion cells will eat the proper clean food. Not the damaged food that you keep inside after 6 hours then you eat. Cannot. Okay, so balance it. Okay, so intermittent fasting, you don't need to worry intermittent. Don't starvation. Lunchtime you eat lunch. Okay, eat a proper lunch. Don't eat too much. Eat for yourself. Okay, don't eat too much. Eat yourself. Okay. Okay, number 10. DXN coffee and juices, Moringa and Roselle are very sweet. What sugar mixed with them? Diabetes care to take. See, diabetes nothing to do with sugar. Remember that. If you go hospital, you fainted, they still give you a sugar water to drink. Sugar is different, sucrose is different, fructose is different, glucose is different. Glucose is the one that pancreas will release the insulin. Remember that. Only glucose is being released insulin. Fructose, sucrose won't give insulin. Pancreas won't give insulin for that. Okay. So where to get glucose? Glucose is been, you get glucose from your digestion. When you eat starch, okay, when you eat starch, rice, wheat, all these things, starch food, the starch when enter your mouth, mix with your saliva, it become a pre-maltose. The pre-maltose enter your stomach, digest with your enzyme, renin, peptine, all your acid hydrochloric in your stomach. After digestion complete, your pre-maltose become full maltose. When the full maltose enter your small intestine will give your maltase enzyme. This is released by your small intestine to the maltose. When the maltase enzyme combined with the maltose, the glucose will created. So remember always, glucose has been created from the 3 processing system. That's why in the long run, those days, people always said, our old ancestors said, munch properly and eat. Don't drink water while eating. Munch properly, slowly munch. Use your saliva as much as possible. When you follow the actual root things, then your food is completely digested with a good glucose. And this good glucose from your small intestine enter your bloodstream. Pancreas job to verify that glucose is good or bad. If good, it will release insulin. If it's bad, it push it out for the urine. That's why you can see there's a lot of glucose in the urine. The moment you get a lot of glucose in the urine, mean that your digestion is failed. You need to improve your digestion, improve your eating habit, improve your munching, improve your saliva, use your saliva. Sugar is a sucrose, sucrose. Fruit is fructose. Nothing to do with this. These things won't harm you. If sugar really kill diabetes, I tell you, sugar has been banned in the world. If fruit really kill your things, none of the fruit has been sold in outside. Correct or not? If sugar really kill people, you think government will ban the sugar or not? Will ban. See, we don't understand the reality. The problem is people don't understand. So you, by taking a small amount of sugar, no harm to your body, it won't increase. The machine that measure the glucose is actually measure everything. It never show you how much of fructose, how much your glucose, how much your maltose, how much your galactose. It never show you. See, in reality, if you got time, you go and research on this thing. IR study, UV spectrum test, NMR study. These three tests, when you do, it can break down the blood and tell you how much maltose, fructose, glucose in your body. We only need to be worried on the glucose, nothing to with the sucrose. Okay, so you don't worry on that. Instead, the percentage they use in this, all the enzyme, everything, a very small amount. The coffee also not even 3% to 4%. Okay, and people always carry about nowadays brown sugar, white sugar, this sugar, that sugar. Actually, sugar playing a small role only in your body. By taking small amount, nothing wrong. Glucose water also created from the sugar. White sugar, IV, glucose IV, they are white sugar. You go hospital, you already fainted. They put the glucose drink to drink. Testing for the pregnancy, all these things, glucose, white sugar. Okay, so you must see everything you use of white sugar, but don't take too much of white sugar. That's not good. By taking small amount, actually is created as energy to your system. It won't harm you actually. Okay, don't every day like put 2 spoons of sugar, you drink and drink. No lah. But from small amount, little bit of adding sugar is nothing wrong. Okay, even though you feel giddiness, then you think, hey, my maybe sugar level go. You take the white sugar and you mix and drink, then you become okay already. So no need to worry. Okay, the amount that given inside all the things is been calculated, so it won't harm you. Even though you see in the morinzam juice there's a sugar added, glucose, they put it sucrose. Okay, enzyme sugar. Sucrose is the enzyme sugar. They already convert it to enzyme sugar. Enzyme sugar will create more enzyme to your digestion because a lot of enzyme is a sugar. Most enzyme are sugar. It digests your system. It digests your food and create energy to your body. If you don't eat sugar, you don't have energy, you know. Okay. So don't worry on that things. Everything is calculated and thing. The thing is, don't eat sugar a lot, making a coffee. You put extra 2 or 3 spoons sugar. Don't do that. The amount is there is already calculated per cup. Because when you mix with water, it already diluted. When it diluted, the gram become very small amount. Okay, so nothing to be worried. Okay, number 11. Having 90% vegetable diet sustainable or good, or go for 6 months only. Okay, this is very subjective. Depend whether you can take or not. Having 90% vegetable diet sustainable, okay. I'm a vegetarian. I'm taking a lot of vegetable per day. So it doesn't harm you. When you take any organic things or anything, it doesn't harm you. You can take or not to take, it depends on you. But mostly I always advise, go for more vegetarian. That is important. Always practice 80-20 rules. 80% of vegetable, 20% of the meat. Okay, not 80% of meat and 20% of vegetable. That is wrong. Okay, go for 80-20 rules. If you're vegetarian like me, I'm vegetarian, I'm taking a lot of veg every day. No problem. It won't harm you. So it doesn't harm you or anything. So go and take mix variety of vegetables and eat. Or don't every day eat kangkong for 6 months la, mati la like that. Okay, so don't eat like that. So mix and variety. One day salad, one day veggie, one day kangkong, one day puchobi, one day. There's so many vegetables in the market la. Mix it and eat varieties. Okay, then you have enough nutrient contents to your body la. Okay, number 12. Is it true cancer patients should not take raw veggie or salad? Okay, taking raw veggie or salad, it doesn't matter. Okay, normally cancer patients, you need sugar also for energy. If you don't take sugar also, they don't have energy. Okay, So you balance your food. You see, depend on type of cancers. Okay, type of cancer we have to see what kind of cancer they are in, and if colon cancer, if they cannot digest properly with the veggie, so we need to change the food. So it's very subject based. We need to see what kind of cancer patient and what kind of intake they can take and not to take lah. Okay, some veggie are very raw, hard to digest. Some veggie are very soft, easy to digest. So we need to see what kind of system they have, what kind of problem they have first. Then from there we advise them accordingly lah. Okay. So it's very subject based, but cancer patient nothing to worry to eat veggie and salads, no problem. You can blend it all, you can drink. That one is okay. Everybody can drink, no issue. Okay. Instead, a lot of veggie, raw vegetable have a lot of amino acid and nitric acid. Nitric acid is one of the powerful content to suppress the cancer cells actually. Okay. Every month, my doctor have menses pain. Why and what supplements best to relieve the pain? Okay, menses pain is actually standard, unless the pain is high or low, depends. Because when the wall are breaking down, the pain sure come, because that's why the bleeding. So every time the wall range rebuilt and demolished, rebuild and demolished. So that's why they have the pain. So when it rebuild, when it demolish, the pain coming in depends. Sometimes the demolition is very fast, and it can touch the wall lining of the blood vessels. Okay, that time they have a big pain. So it means that the rebuilding of the wall is too slow. So not enough nutrient to supply towards the rebuilding and demolished. So you need a proper nutrition to give. Once you give, for these cases, you can give them a morinzi or morinzyme with fruitzim, GL powder, spirulina. So give this four: morinzyme, fruitzim mix, GL powder, and spirulina. You can see they are much better, and the pain will be reduced automatically. The next month, the pain is very low already, because they have enough nutrient to rebuild and re-break, okay, and balance back. So they have nothing to be worried lah. Then the pain will reduce. Okay, number 14. Remedy for overactive bladder and frequent urge to urinate. Sometimes overactive bladder is infections. Okay, overactive bladder is infection. Sometimes when the infection started in the thing, it's also lack of sodium in the body. So that's why when you go any type of a UTI or overactive bladder or frequent urination, normally doctors will prescribe you the urine. Okay, it's a sodium, it's a garam lah. So what you can do, you can take our Himalayan salt also, you can drink, or you can go for codipine richelieu mix. Codipine richelieu mix, and you take spirulina and also bee pollen. This will reduce your overactive bladder in the long run. Okay, then your frequent urination will improve lah. And another thing, overactive bladder also will activate when your body is too cold. When you sit down in a cold environment, because in a cold environment, your blood circulation will be more faster. Okay, because to balance your heat, so the system need to run more fast to create the heat. So when they create the heat, because the body outside is very cold, the heat is more, the blood circulation is fast. This will impact your collection of your urination. That's why normally when you hot time, heat time, you don't frequent urine. But when you go to cold environment, you will go urine, because your system metabolism is faster to increase your heat in the body. But that will create more urinations lah. Okay, so that one no problem. You can take codipine, GL powder, bee pollen, and also spirulina. That shouldn't be a problem. Recommendation for potential diagnosis of colon cancer: head tumor removed, intensive biopsy, waiting for result. Okay, very simple. We've been losing weight and no appetite, so give them a micro-veggie morinzyme. Okay, with add in the fruitzim. You must give more lion's mane suck, 5 tablets, suck 2 times or 3 times daily. then give him some spirulina to improve the weight. Okay. So then monitor closely, then we can see what is the next. The appetite will come back. You can give them a spirulina cereal, you can give the cordyceps cereal, change the food into a small food base, a small particle food base. For after operation, they cannot take raw food. So you need to break into small chunks or grind it and give them. It's much better. Okay. Can constipation can take pearl powder? No problem. They can take. It's no issue. Is chili spicy okay for the cancer patient? Okay. Chili or spicy food is not recommended, but you can give them what you call black pepper. Little bit of black pepper, mild spicy, okay. Black pepper spicy is very good because black pepper is anti-inflammatory and also very good for colon cancers. That's why we always give the black cumin, because black cumin contains 5% of black pepper. Okay, so the black pepper 5%, clove 5%, and 90% is cumin. So all this combination powder will enhance the anti-inflammation and colon balancing. So any colon patient is good to give a black cumin. Black cumin is very good for the colon cancer patients. Question from member, what is the benefit of Hong tea and there's any testimony? Okay, Hong tea mostly we giving to people that has a plaque, lot of plaque. The plaque not only at the heart, it can be in the leg. Okay, that means varicose vein. There's a blockage in the blood clot in the varicose, the veins, and also any what do you call triglyceride issue. Triglyceride, then they have a cholesterol type. The triglyceride is very high. When they use Hong tea, this result can come down. We can cleanse it out. So there's a lot of my patients that have heart block. I start to give in Hong tea. So after a while, you can see the plaque has been cleansed. So they are free from the block. Okay, I got so many testimonial on that. After they're taking that thing, then they go and check up again. They can see the blood flow in the heart is much better than before. And the CRP rate, if you have the CRP, C-reactive protein, very high in your heart rate, C-reactive protein high, you give them a Hong tea mixed with the Morinzi or Warinzan. Then after 3 months, you go and check back the CRP rate, it come down. So these are the things is very good for the heart. And it's not only for the heart, it also cleansing any blood vessel blockages or any blood clot blockages in the blood vessel system, circulatory system. Okay, and also very good for the triglyceride high. When you see cholesterol marker, you see the triglyceride. If the triglyceride is very high, you give Hong tea, the triglyceride can come down. Okay, it cleanses the deposit in the very good in clearing deposit in the blood vessels. Okay. Okay, what else they are asking? My daughter Marji, can she take Roselle too? Okay, Roselle can take, no problem. As colon cancer patient doesn't matter. Roselle, vitamin C. See, remember, cancer patient, you must give more vitamin C. That's why fruit is very good for the children, for the cancer patients. So when you give our Roselle, Roselle is highest vitamin C in the world. It's not only contain of vitamin C, it also contain of magnesium, iron, phosphorus, calcium. So it also enhance the blood flow. It also increase more hemoglobin. It also increase more RBC, red blood cell. So for cancer patient, they need all these things to improve. Okay, so when they have all these things to improve their blood circulatory system, the cancer cell will have a surrounding with a lot of blood supply. When a lot of blood supply start to enhance, the cancer cell chances to shrink is very high. That's why vitamin C is very good for cancer patients. Okay. Hong tea pad for weak cancer patient. Normally Hong tea kidney patient I don't give yet. Need to research on that. Okay. But so far I don't give anything to my kidney patient. For kidney patient, normally I will recommend that myco-veg, morinzyme, podipine and GL powder. Okay, these 4 things more. So these 4 things can rebalance back the kidney patient, the kidney can improve back. So you can reverse back the kidney. I've reversed so many kidney patients. So it's proven reversed. So I'm collecting data before I do the publication. So I not enough data yet. So I got some data. So because we are still monitoring for 6 months to 1 year patients. So when we got all the enough data, so we can compile it, I can come out with the publication. So then you can have the complete publication improvement of the kidney patient. So I got now I already have a few cases, but still a lot of cases, because all the kidney cases, all these things you want to improvement, they call it longitudinal research. Longitudinal research, at least you need to have 3 to 5 years time. So then you compile the data, you publish. So you cannot compile it in 6 months. So we need to monitor for 5 years. So that's why the data is only 2 years data I keep. I still need a 3 years data to complete. Then only I can publish it out. Then the data will strong, the paper, research paper will give a big impact to the world. Then whoever gave kidney problem, they can read that, they can compile, they follow that, definitely they can reverse back. So one by one we are doing, but it take time. That's why longitudinal research is take time. And it's more powerful than the short-term result. Because the short-term result, you can go and catch 20 people, then they just get the review, they ask them to sign, they might be tick without any consent, a lot of research has been done like that. So that is not correct. A lot of research papers you see, and they come out with the publication, they just go and send the questionnaire to people, and if you bought, you just tick, oh, okay lah. Then we compile the data, it might be not true. It might be not correct. So what we are trying to collect is the real data. Means that before when the kidney problem, after they taking the Ganotherapy, blood test 6 months, blood test 1 year, blood test 1.5 years, blood test 2 years. Then we compile all this data so we can publish it. So that's why the publication it need more times. But at the same time, we keep on reversing quite number of patients here. I got a lot of kidney patients here. But most of the patients, when they came, they come at stage 5. Wow, very hard to treat. Stage 5 means their kidney is almost gone, 70% to 80%. So they only have 20%. It's not easy to reverse, If they have at least below than 50% stage 2, kidney stage 2, the chances of recovering is very high. But when they go more than 50%, you see 20% also in a modern medication view, we don't have enough medication to balance back. No. So, but in nature medicine, I've reversed 20%, all become normal. But 60% stage 4, stage 5 is very hard to reverse. But stabilization has been happened. So we are able to stabilize them from they going to dialysis. But they must take care of their food, their time frame, their sleeping time, their activity. A lot of things they need to change. And most of the kidney patient, I ask them to become vegetarian. So much better, because the moment they put a kidney, the moment they put, the moment they put animal fat, they got problem already. So that's why kidney patient, when the kidney got problem, better become vegetarian is best. Vegetarian best, then we can reverse them very fast. Otherwise, they have a big problem. Okay, so that's the thing lah. Okay, so what is the next question? Let me see. Hey, where I miss, So many questions, no question. Straight away, come. No more number really.
Fatty liver, doc. Fatty liver. What do you recommend for fatty liver?
Fatty liver. Okay, fatty liver is standard. Androgen RGGL is enough for fatty liver. Kidney patient, high triglyceride, you can give RGGL, you can give Androgen, you can give Monascus, you can give a Hong tea. Hong tea is a must for triglyceride reducing. For triglyceride, you give him Monascus, RGGL, Monascus, Hong tea is enough. Okay, so you can for Hong tea you can go for capsule, or you can go for powder. If you go for powder, you just mix it with Morinzila. Okay, so what are the medicines they should recommend for asthma patient? Okay, using inhaler, ask them to continue use the inhaler. At the same time, give them spirulina, give them GL. Don't give RG. Give them GL, spirulina, vitamin C, Rosel. And you can give a cordyceps, lignopine powder. Lignopine powder or lignopine. Okay, so slowly you give them. When you start to give slowly, they're taking. You can see the first improvement. The patients start to reduce the inhaler because they feel better. Okay, when they feel better and better, instead of 4 times they're using inhaler, you can see they're using 3 times. After a month, 2 months, they're using 2 times. After a month, then 1 time, then slowly they're no more using already. So this is how the improvement. So take together with the modern medication and slowly you can see the improvement. The patient itself will reduce it because they can see the differences. Okay. What do you give for kidney patient just now? Okay. For kidney patient, you give the dosages myco-veg, morinzyme, myco-veg 1 scoop, morinzyme 10 ml, mix in half glass of warm water, shake it and drink. After you drink this first dosage, wait for 30 minutes, then mix codipine 10 ml, GL powder 1 scoop. Mix in half glass of warm water, shake it and drink. This is supposed to become after 30 minutes. First dosage, second dosage. Morning 1 time, night before sleep 1 time. Okay, so keep on continue taking that. Control your water. Don't take too much of water. Don't drink too much water. Every time when they want to drink, they must go by sip, not glass by glass. Okay. Second thing, walk at least half an hour per day. Eat on time, very important. Okay. Eat on time is very important. And don't drink too much of water. Take a breathing exercise lot. Breathing exercise 10 to 0, counting. Take a deep breath, release. 10. Take a deep breath, release. 9. So why deep breath is important? To make sure the lungs always have the airflow and the lung is always open. Then they don't have enough, they won't get in a cough. If they don't do the good breathing exercise, then the lung can compress. Okay, then the water can retain inside. So to avoid that, half an hour walking, breathing exercise, anytime they can do a lot, then eat on time, get a good 6 to 8 hours sleep. Follow that, then they can see slowly, you can see the improvement 3 months to 4 months, 5 months, 6 months. Mostly it takes 6 months to 1 year, if depend on the stages. Okay. So what else we see? I think finished already. Okay. So these are the main things today we shared. Hopefully it's beneficial for you all. Okay, you can help a lot of people outside there. So in case of anything you need help, you just WhatsApp me. And if you see I don't see the WhatsApp, I don't reply, please resend again, because I got so many of WhatsApp, not only from Malaysia, from a lot of countries. Yeah. Okay. So when they need help, we need to see, because when I see the WhatsApp, sometimes I see I want to reply, I forgot. So your WhatsApp is go very low already. Okay. So remember that. Okay. So anything, just let me know. Okay, I stop the video first. Then you can check. Okay. Ayo.
Kami.
Break.